is the, everywhere you go, people are talking about it. And it seems in the, at the state level, the governor has made this commitment of over $1 billion to go into the system. But again, what system, right? I mean, that's ultimately the question. Where do those dollars go, and who gets them, and what are they doing? And for us here in Rochester, our big question was exactly that. Most of the focus seemed to be on more inpatient beds, yet we're not necessarily seeing as that's the place where it would make the most sense, right? So for us, one of the things that we're trying to do is understand, number one, what kind of services people are getting versus what they want, what they need, who's doing it, and what I would encourage. I have to leave at 10:30 and I feel really bad about it, but my daughter failed to mention it was PSAT day today at school, so I have to go get her. But Nia's here, Nia, from my office. And so one of the things that we're trying to do with Common Ground Health is make sure they're talking to the folks that are the sort of non-traditional people that you think of that are doing this work. And I would really, anyone who can get her information of organizations that are doing it, we really need to understand what peer support mental health services are out there, how we're doing it. We know that's what works. And at the state level, we fund things locally, right? It's that reimbursable system. So often the people are getting money are those well-resourced organizations, yet they're not necessarily trusted voices in communities. They're not helping the people that that struggle to find a place to go, or struggle to find a place that gives them the services they need. So we also need to know more and more about those non-traditional organizations that are doing this work. And so anything you can get to me about that so that we can make sure it's on Common Ground's list of things and people to talk to, so that we can truly, mental health is everything from diagnosable, but what we're seeing is more and more on emotional and social support, helping deal with and work through trauma in a way that a person wants to do it, and giving those opportunities and those chances. But if we can't capture it in any way, we're not gonna come up with a really good plan of where dollars should go. And that's my dream, and I know Senator Brooks' dream, is to really change the way mental health is serviced, I guess, in our community, to really more meet the needs of those who need it. And so I'm just encouraging them to do that.
Thank you.
So we talk a lot in our continuum about housing first, and I know we're going to talk a little bit about that in a second, and also about supportive housing, but also about how our community kind of puts this onus on supportive housing providers to like fix everything. And I always like to remind people that that housing exists within a community. It exists within the existing community resources. So if you are having a hard time getting a therapist, the person in supportive housing is also having a hard time getting a therapist. And just because they have a case manager, just because they are in a program, does not change the lack of community resources and the lack of access to those resources that you are also facing. So a lot of what we've been doing lately is bringing these meetings together where we bring together mental health providers and our supportive housing providers, and we're like, talk to each other, because our supportive housing providers have a population of folks that need your services. We have common goals, like whatever your goals are for the number of clients or the severity of need that you need to be addressing with your therapist, you can come into our spaces. We'll give you a room to talk to people that's private. We'll make sure that you are able to talk to the people that you need to, but we do need physicians and mental health professionals to be integrated into our spaces, to come down to the emergency shelter, to come down to the supportive housing that we have, and really just be available to folks, because a lot of what our supportive housing providers are finding is that people have immediate needs, similar to what you're saying about, after 5 p.m., 2 in the morning. People have immediate needs, or they're ready to go to treatment, and the resources are not ready for them. But we know the most about these folks more than anyone else, arguably, that clinician is treating. We know when they're going to be moving into housing. We know when there might be some difficulties with that transition. And so really increasing that collaboration across providers, and if there are different physicians or mental health professionals in the room, talking with those supportive housing providers to see what are the ways that you can be integrated, what are your common goals, and what are the ways that we can kind of meet people's needs where they are at, because they're here in our communities and we know where they are. I just wanted to add that as well.
So echoing that piece, and thinking about what would happen if our city decided to mandate the arrest and fining of people who are unhoused. What that materially means is we remove people from community. We know that when people, whether they're unhoused, whether they're using drugs, they are much safer when they are not alone. They are much safer when providers know exactly where they are, can go bring them food, can go bring them tools for harm reduction, can talk to them and be in community with them. So it's not addressing the problem to do these sweeps or to arrest people, it just exacerbates it, right? You can't get the chance to recover if you're dead. When you use alone, you die. When you're unhoused and by yourself with no one to talk to care for you, to cry with, you die. So these communities that we see where unhoused people are together and camping together and eating together and using safely together, they keep people alive and give them a chance to recover.
Thank you for naming that, the councilman. I think another thing to add is just that in addition to the displacement that happens, right, is that, the trust that has been built between SOS workers, peers, outreach workers, with folks who are unhoused, when they do these sweeps, that trust gets broken, right? And a collateral consequence, as you said, folks die. And so, first of all, I just want to give it up to this panel, because I'm like, I can sit here all day. It's a great day. We're gonna have a final question, and then, get your questions together, and we'll turn it over for Q&A. We'll get the Assemblywoman out of here by 10:30. No, this is when it ends. And so the last question, is around, housing solutions. And we've heard time and again, I think the legislator mentioned, we know how to solve the problem, but there's an issue of political will, right, and investing at the scale that we need. But also nationally increasingly, we've been seeing this really coordinated and invested anti-housing first movement. And I think in New York, not as much in other states, but it's really just a matter of time. I'll say downstate New York City, having that mayor say things that I'm hearing in places like South Dakota is concerning, right? So I don't think we are immune from this coordinated effort. And so, again, I want to turn it back to the panel to, give some final insights on, what we can do in this room, advocates, organizers, providers, electeds, impacted people, to ensure people have the access to housing services when they need it most.
It is kind of baffling, and I know we're saying the same things kind of over and over again in different situations, but we took a ride with the PIC team, the Person in Crisis team, last year, and having conversations with some of the folks there was interesting, because they're like, our crises pick up at the end of the month when food stamps run, when SNAP benefits run out, when rent is due, and it's perplexing to over and over again understand that when basic needs are not met, people go into crisis, right? Like, it's, again, not rocket science, we're not learning anything new here, and yet every month we just, hit alt cycle, repeat, whatever, I don't know, and we just repeat it again, and then we wait till the end of the month, and then we have more people in crisis, and then, then it's January, then it's February, and we don't stop, and we don't just break that cycle and say, well, what if we did this instead, and then we didn't have that, crisis at the end of every month, and we kept people out of crisis and stabilized people in their house, in their basic needs, and that would totally change the way people feel in our community. It would help people get, if they need it, more help for whatever it is they may be facing, but yet we just choose again and again not to do that. One of the things, though, that the city has said to us is sort of the responding to crisis is what we would all consider healthcare, right? So responding to a mental health crisis, we should pay those folks who are doing that like you would a doctor or anyone else who's doing medical care. If we were able to do that, the money that currently is being spent from the city to respond to crises could then go into the back room and really beef up that ability to say, well, now how do we stop people from crisis instead of always just responding to it? So we have been in those conversations. We're trying to figure out how to do that statewide as more and more of these, sort of social work model, peer modeled crisis response teams, Daniel's Law, other things go into effect, is if we can figure out a way to make that something that is truly health care and then use those dollars that are currently that system to keep people out of crisis, I think we will go a long way. So there are some solutions out there. The housing piece, again, I'm open for business all the time to hear your ideas, because we really need to start those conversations. Like I said, we can change it. We changed it around basic income, and we can start to really have an effect. And it may not be as immediate as we want it, but it will help.
So speaking of the person in crisis team, the person in crisis team budget for the whole entire city is around $1 million. And this is to respond to a mental health crisis. They are hoping to add 2 peers for the whole entire city of Rochester. The police budget is over $110 million. And with that kind of investment, what that materially means is every crisis, every issue we have, the only organization fully equipped to respond is the police. By design, our systems are not working to address the complexities we have as a community. So a clear solution is actually investing in things that are non-carceral, things that don't criminalize people, and things that give people care, dignity, and compassion. We need to invest in harm reduction. We need to create an opioid prevention center, overdose prevention center here in our city. We need to fully invest in wraparound housing and services, quality housing at that, not just, when people come out of jail and prison, right? Their only options for housing, the DSS, $440, it may have increased, it's still $440?
Yeah.
Right, to cover housing, like how in this economy? Why aren't we actually investing adequate resources and paying for quality houses, not rooming houses? Not rooming houses where people don't have their lights, they don't have hot water, they don't have heat. It is absolutely ridiculous how we choose to spend our money. And when I say our money, it is literally our taxpayer dollars. We want our neighbors to be housed, that's a fact. Like, no one wants, I believe at least, and judging by like us being here early in the morning Thursday, we want our neighbors to be housed, so we should have a say in how that money is spent. So advocacy around that, showing up to speak to council, and on some level we have to think of just building it ourselves. I think of Raw New York, I think of so many PCHO, MC Collaborative, so many people are saying, you know what, I relied on the government to do it and they will never get it right, so we're just gonna build it ourselves. Like we have all the tools, like Carolyn was saying, that we need to make things happen. While we're advocating, while we're doing all these other things, we also have to, at some point, say, you know what, enough is enough, we just have to do it ourselves. We have to figure out how to get government grants to build the housing that keep our people safe, to fundraise, to build harm reduction organizations and institutions, and also advocate in front of our leaders. Unfortunately, we have to do it all with no resources, but it's possible because we're here today, and we just have to keep fighting and force our city to invest in things that we know work and keep people safe.
So she's not gonna say it, but I'll say it. Stanley's running for re-election next year, and she's gonna need your help. And I just wanted to encourage you again. So politics, these positions of power were kind of abandoned to mostly the worst type of person for decades, right? And then in the past 5-10 years, a bunch of young weirdos ran for office, and some of us won. It can be really discouraging, right? Because we go and we knock doors and we make calls and we do the donations to run a champion like Stan or like Sarah. Are you gonna run? And then they get into office and we're not as politically literate because a lot of us we're like, what, politics? Okay, I guess if I have to, you know. And it feels like it's almost like there's this letdown, like nothing changes. But it's because there's 29 of us where I am, right? And there's 9 where Stanley is, and so we're 2 votes away on city council from having a group of people that I guarantee you will fund housing, will fund affordable housing, will fund community-owned housing if given the opportunity. And so we have to hang in there because we got really excited and we run people like Stan, and we run people like Sarah, and then we get frustrated because they're not a majority yet, right? Politics was abandoned to the worst type of person for so many years. And it's this real long-term thing, and we have to do harm reduction now, like Stan said, we can't wait for the government to save us, but I do want to encourage you that it is possible to take a majority on these bodies, on these councils, on these legislatures, and to kind of hang in there. And so we're 2 seats away from that housing first majority on city council in Rochester, New York. I'd say if you give us 3 more housing-minded folks at the county, we can do meaningful things there in a different type of way. So I just to be an elected up here, it's just ugh. But hang in there because it is possible. And I know it can be discouraging when we get someone like Stan or Sarah into office and it feels like nothing changes, but it's a numbers game that we will win, that we can win, and this will get better. I truly believe that it'll get better, and it's possible to do that. So I just want to encourage you that hang in there, keep pushing your policies, and keep pushing for housing first people to get into these positions of power, because 5 is more than 4, and we will get these things done if we can get those folks in there. I wanted to highlight, before we, wrap up here, that the primary cause of homelessness across this country is financial. When you look at mental health, rates of mental health, negative mental health, when you look at rates of substance use disorder across this country, neither is more correlated with the rates of homelessness across this country than the ability to afford the housing and the cost of housing. And I'd like to highlight that we had a representative from the United States Interagency Council on Homelessness who came and talked about how West Virginia has one of the highest rates of substance use disorder in the country, and also is not one of the highest states that has the highest rates of homelessness, right? It's just not, the issue that we're facing in our country is late stage capitalism. It is the inability of people to be able to afford their housing. And when we circle back to kind of the dehumanization of people who are forced to live outside, or who live outside, or who are in our emergency shelters, just a reminder that those folks are not any different from folks who are living in housing, besides the fact that they likely are not able to access or afford that housing that meets their needs. It's the commodification of housing that has gotten us to where we are now. And if housing is a human right, and if we want it to be a human right, we have to invest in solutions that help to counteract that. So really things like universal Section 8, guaranteed income, a single payer healthcare system. How many people had a major health crisis and then we hear they paid this outrageous medical bill, which made them not be able to afford their rent, which led them to where they are now. Remembering that housing drives mental health issues and substance use disorder, like homelessness drives those things just as much as those things could drive homelessness. So that homelessness as an experience can be traumatic for folks, and it's just not acceptable, I feel at this point, to not address the fact that this is a crisis that is created by us, kind of similar to what Pascal was saying earlier. This is all fabricated. We look at compliance, we create all of these barriers to accessing something that people need, and that is what is driving the crisis that we're seeing right now. So it is possible to solve. We need to help people be able to afford their housing. We need to make sure people have the supports to be able to recover from an experience of homelessness. And so supportive housing and low barrier shelter, so that people can come inside and meet their basic needs with dignity, that's the solution.
We have a couple minutes for any questions, but while we do that, think of your questions, but just another hand for this amazing panel.
Hi, I'm Jean Carroll, and we had an opportunity to express our political will on November 6th. November 5th, election day, if you're registered to vote. We all know that homelessness disproportionately affects marginalized communities and people whose identities are not accepted norms, let's say. But there's a proposal, it's called Proposal 1, which is you get to vote on this. It's not your elected official, but elected officials have already voted on it to put it on the ballot. And this would change the New York State Constitution, banning government discrimination based on sex, age, gender identity, disability. All of these things, surprisingly enough, are not in our state constitution. The only areas that are listed in our state constitution are religion and race, which is great, but it's not comprehensive enough. So when you go to the voting booth, you'll vote on your legislative officials, but you also have a chance to vote on this proposal number 1. And in order to do that, you have to flip the ballot over, okay? So please consider doing that. I'm working on a rally for equal rights on October 21st to bring people's attention to the fact that this exists, because people don't know about it. So Proposal 1, it's an amendment to New York State Constitution, and I encourage you to support that.
One last question? No? Anything else from our panel? Well, thank you so much.